CBS 4 State House reporter Hannah Adamson has more on how this could cause a ripple effect across the state's healthcare system.
The One Big Beautiful Bill passed in the Senate earlier this week by one vote, and today it faced a similar battle in the House after House Minority Leader Hakeem Jeffries delivered an 8.5-hour-long speech protesting the bill. It passed by 4 votes. As the One Big Beautiful Bill heads to President Trump's desk, Democrats warn 250,000 Hoosiers, including 125,000 on Medicaid, could lose their health care coverage.
It's a crime scene going after the health and the safety and the well-being of the American people.
While many Republicans say the bill delivers the biggest spending reduction in U.S. history, some question if that many people will actually lose health care coverage.
The Democrat talking points that they have done a good job of trying to scare people, that people are going to lose their health insurance. I just don't think that it's as realistic as what they'd like to say.
The FSSA says the bill could force Indiana to significantly roll back eligibility for the Healthy Indiana Plan, a state Medicaid plan that covers Hoosiers ages 19 to 64.
Candidly, we don't have the general revenue fund dollars necessary to make up the difference. If that were to pass, we're going to have some very difficult conversations to have in the coming legislative sessions.
Democrats say kicking that many Hoosiers off Medicaid could also put many smaller hospitals at risk.
Our hospitals rely on Medicaid. Our emergency rooms rely on Medicaid to stay open. With these cuts, hospitals, especially rural hospitals in the state of Indiana, are at risk of closing.
In a letter to Trump sent by Democrats before the vote, the bill's Medicaid cuts could force at least 12 rural Indiana hospitals to close or scale back services.
It could be the case that in some communities in Indiana, patients have to drive for at least an hour or 2 hours to get to the closest hospital system.
But some hospitals on that list say they shouldn't have been on it. Community Hospital of Bremen says the lawmakers' letter contained outdated information. A statement reading in part, quote, "Community Hospital of Bremen leadership wants to reassure our community that the hospital is not at risk of closing." In a statement, the Indiana Hospital Association says it's not aware of any hospitals planning to close at this time, but that it's also disappointed in the bill that passed and warns this could lead to cuts in services, increased wait times in emergency rooms, and facilities potentially closing in the future. In studio, Hannah Adamson, CBS 4 News.